go ahead and get started. The recording is going, so we will just start that. I'd just like to welcome everyone tonight. My name is Michael. I'm the administrator for the Montana State Fire Chiefs, and also the grant administrator for our FEMA grant, our SAFER grant, which is what allows us to do these leadership trainings every month. And we've been trying to do them every month. We don't always accomplish that, but we've been trying to do them every month. So if you've missed any of the trainings, we do have them all recorded, and they are on our webpage, and we'll put the link to that webpage in the chat after we go on this morning, this evening. And so if you want to go back and watch any of those, and then this one will also be recorded, so if you want to share that with anyone, it'll be on the webpage in a couple of days. I just wanted to let everyone know that we will be putting a link to an evaluation in the chat later on in the presentation, and we will also be putting a link to the certificate of completion in the chat. So you'll have that, so just to show that you've completed this training. So again, we'd like to welcome Jodi and Stormy tonight. They are with the Montana State Fund. And so in this session, participants will learn about workers' comp and how participating with the Montana State Fund can help them stay safe on the job. And if an unfortunate accident does occur, how to manage that with a positive outcome. So I'd like to welcome Jodi and Stormy, and they will be introducing themselves. Thanks for joining us tonight.
Thank you. My name is Jodi Blixt. I am a claim examiner here at Montana State Fund. I have worked at Montana State Fund and been an examiner for almost 10 years now. I handle a lot of state agency policies. I do handle some firefighter claims. I have my background, I guess, is I graduated from Montana Tech with a degree in occupational safety and health. But yeah, I've been with Montana State Fund and handling claims and helping out employers with claims and how to file them and how we work through the claim process and how we can have those positive outcomes on our claims for about 10 years now. So that's all I have. Stormy, you go right ahead.
Welcome, everyone. Thank you, Jodi, for the introduction. My name is Stormy Tuffield. I'm a safety consultant with the Montana State Fund. Basically, my job with the State Fund is to partner with policyholders, partner with organizations that have workers' compensation insurance through the Montana State Fund to build, maintain, or enhance their safety and their risk management programs. And really, understanding the workers' compensation process is kind of the foundation for a lot of these things. And so what we're going to be covering tonight is just the basics of workers' compensation. As you can see on the screen, we'll cover the basics, how premiums are calculated, claims and benefits, claims reporting, and return to work are going to be the big things. And then there'll be some time for questions and answers at the end. How did I end up being here with you all this evening teaching this class? I've been with the Montana State Fund for 5 years as a consultant. Before that, I was with the Montana Department of Labor and Industry as their safety and continuity coordinator. Before that, I started my career in the military in 2006, and it's continuing to today. So I've been in for just about 16 years, minus one that I took off for school. And so in that time, I've been able to work with private companies, public agencies, as well as a number of different industries, to include those that would handle firefighting. I do a lot of work with Department of Military Affairs for the fire season when they bring on firefighters, soldiers that are trained to fight wildland firefighters, fires. So we've been able to do some interaction with them. And so it's a privilege to be able to be here with you guys this evening. I'm looking forward to going over this content and answering questions that you may have. If you guys do have any questions throughout the course of this presentation, I'm pretty relaxed, right? So feel free to interrupt if you want to, or put them in the chat. And then at the end of the program, we have some time to go over some of those questions and provide the best answers that we can. Does that sound good? Okay. So where we're going to start is just understanding why we have workers' compensation. What is it and why does it matter? So if you would, go back in time with me to the early 1900s. And in the early 1900s, we would all be, say, working at a logging company. And as we're working at the logging company, we all get injured, right? There's a big issue, and a number of us get injured. Well, our only course of action in that time was, one, to try to sue our employer, right? I was making about $20 a week as a sawyer for a logging company in the early 1900s in Montana. My logging company is probably going to retain better counsel, right? The other option is to pay for it out of pocket. That would cost about $78 to reset a broken bone or whatever it may be in the early 1900s money, not today. It's $75 just to walk into the emergency room, right? But then, so there's no way that I could have paid for it myself. So what we see in 1915 is that Montana decides that we're going to participate in the insurance coverage program for workers. Okay, so 1915, the workers' compensation laws implemented in the United States and then in Montana. And so what that law does is it replaces the tort system, or the way, or in other words of saying, the system where we have to sue each other to try to make this moment right of this on the job injury, to a no fault system. Basically, if you're going to do work in Montana, you have to have workers' compensation insurance. And if someone's injured on the job, this is the way that it gets covered. So there's no fault. There's no suing one another. It's what's called the exclusive remedy. And so what this exclusive remedy did for injured workers in the state is it paid regardless of fault. It paid specified benefit amounts. Employees would give up their right to sue the employers, right? But I also retained legal representation and mediation if I felt my claim wasn't being appropriately handled. Okay, so that was another thing that created, which was the Workers' Compensation Court. All that was wrapped up in the early 1900s with this law to start the workers' compensation process for our state. So what does workers' compensation insurance actually cover? It provides coverage for employees that suffer work-related injuries and occupational diseases. And the key term when we're talking about what makes it work-related is the phrase course and scope of employment. What that means is, are they doing work on behalf of the organization that the organization is benefiting from? And of course, we have Jodi here. So when she's like, that's a lame definition, she can fill in a better one. So what does it actually cover? It covers medical benefits, doctors, hospitals, physical therapy, as well as prescriptions. And it also covers what's called indemnity benefits. All that means is monies that we would pay to the employee or to someone else to on behalf of the employee, for example, rehabilitation benefits, or to a surviving spouse if that workplace injury was seen to be fatal. So those are kind of the basic coverages that we see there. Now, this is a really important part of this to understand, because I don't know where everyone has their workers' compensation from. So this is just a number of different ways that workers' comp is established in the state of Montana. So how can you obtain workers' compensation in our state? The first is develop a self-insurance program. And so basically what that means is we're a big enough organization that we have funding internally that we can put it aside to pay for injured employees at our workplace, okay? So that's self-insurance. The organization's big enough they can insure their own employees, or purchase from a private company. So just like when we go off to buy auto insurance or anything else, it's the same thing here. We could go off and find a private company and purchase our workers' compensation insurance through them. And the third plan is purchase from the Montana State Fund. Since the state of Montana requires employers to have workers' compensation in the state, we have to have, as a state, a way to provide that coverage. And that's where the Montana State Fund comes in. We're guaranteed to cover you. With Plan 2, the private companies, same way, like if you have a bunch of accidents on your policy or on your license, you're probably not going to get some insurance from some carriers. They just won't say, you know what, you've had too many accidents, too many issues, we're not going to insure you. Whereas State Fund, we will insure you regardless, right? Now it might cost different amounts. However, we will insure you. We will write you a policy. Okay, so we're called the guaranteed market in that way. So those are the three plans for how you can obtain workers' compensation in the state of Montana. So let's dive in more to those benefits. So the medical benefits, these are unlimited. So it pays what is necessary to restore health, right? It's not going to make you, Iron Man, right? It's not going to make you the $1 Million Man. It's going to make you as restored to time of injury health as possible. That's the other side of it is we will work to get you as close to time of injury health as we can. There is no copays. So if you have an injured employee and they're going to the doctor and like, well, I don't have money for a copay right now in my pocket or whatever the case is, there shouldn't be any copays when it comes to workers' compensation. The work comp provider is going to cover those. So no copays and no deductibles. It is 100% covered through the insurance plan. And it also covers wage loss benefits. Wage loss benefits are if I'm injured so severely that I cannot return to work, the doctor has said you have to stay off work for a certain amount of time, then I will get covered 2/3 of my average weekly wage. Okay. Now, before that benefit kicks in, there's a waiting period of 4 days or 32 hours of work. So whatever comes first, is it 4 days or 32 hours? Once that 4-day threshold or 32-hour threshold has been met, then those benefits start paying. And so that's a reason why in a little while toward the end of our presentation, we're going to talk about return to work and why that's so important. And it'll also pay up to the maximum TTD rate, which TTD just means total or temporary total disability. So while you're recovering, we're paying 2/3 of your average weekly wage up to the maximum temporary total disability rate. Super exciting stuff, right? Because you're like, what on earth does that mean? Right? It's okay for us to be honest, but it's important that as we're going through this stuff, we start to recognize some of this language, because what's going on is say you're getting paid over $50 an hour for whatever you're doing on the outside. If you're injured, that 2/3 of your average weekly wage may not cover what you would normally make during that week. So these are where these things start to matter. I believe the last time I looked at the maximum TTD rates was about $927 a week. So if you're making more than $927 a week at your job, that's where it's going to cap out. So even if you make more than that, and 2/3 would be more than that 972, that's what it's going to be paid. That's the highest that benefit's going to be paid. Okay.
And Stormy, sorry, I'll just add to that. It is less. It's at that percentage because it's a non-taxable income. So that's part of the reason why it's going to be less than what you're used to seeing. It's a non-taxable income. So
yeah, thank you, Jodi. That's a great point. So the reason it's 2/3 is because it's non-taxable. And because it's non-taxable, that third normally is accounted for because you're not having it taxed. So it's fairly close to what folks would make up to that maximum TTD rate. Thank you, Jodi. That's great input. So the actual policy itself is a legally binding contract between the policyholder and Montana State Fund. And the way that this policy works, much like anything else, like when you go and you do your auto insurance, and you got to renew that thing every year, whatever the case is, or add new drivers. And in my case, had to add my teenage driver to it, right? Y'all feel bad for me now because of that. Had to add my teenage driver to it. What that means is when I'm looking at the policy, it says in the next 6 months, you're going to pay this number of premium. That's the guaranteed cost policy. It's not going to change regardless of claims or anything else that happens, right? So the policyholder pays the quoted premium regardless of the amount of claims. Doesn't fluctuate if losses are higher during that current pay period. So for example, if you guys have a policy with Montana State Fund and you have 7 claims this year because you had a really bad fire that you were on, your policy isn't all of a sudden going to jump up in premium cost. It's going to stay the same, and we'll see how those losses will affect the policy over time. But it's a guaranteed cost policy. And there's 2 parts of each policy. One is the workers' compensation, which is the biggest part, which is what we're talking about tonight. And second part is employer's liability. And this is for the rare situation where an employer still has some liability for what's going on outside of what workers' comp would cover. That just covers the legal side to get the employer completely covered through the no-fault system of workers' compensation. So, how are premiums calculated? This is another really excellent topic that when you start getting into the numbers, it's really important for us to understand what is the cost of doing business and what is the cost of having good safety programs and policies in place. How do the cost of doing business and having good safety policies and programs in place mesh and total what the premium calculation ultimately will be? So what influences pricing? Payroll by class codes, and we're going to talk about that in a moment. Rates, or the rate tier that your organization is at, and that's going to depend on how the insurance company that you're working with has that lined out in their policies. Loss history, and so that's the experience modification factor. So those losses that we talked about before, that's where it'll start to come into play when it comes to calculating how much that premium is ultimately going to be. And then underwriting. What is your underwriter going to do? Scheduled debit, where, you know what, your base policy is going to cost this, but we're going to probably need some more from you. Or a credit saying, hey, you had a bad year, but you're working to improve it, so we're going to credit some of that back. Okay, and we're going to see more of how that looks like as we move on in this training. Okay, so just looking at these four elements: the payroll, the rates, the loss history, and underwriting, where do you guys think that you guys can impact pricing with how effective your safety program is? Just think about that for a minute. In payroll, in the rates, in the loss history, or in underwriting? Well, if you are keen to what I'm saying and you said loss history or underwriting, that's right. Because what happens is, in loss history, we're going to see how that influences pricing, where if you don't have those losses because you're taking control of the risk for your organization, you won't have the increase in loss history after claims. Or in underwriting, if you're working closely with your underwriters to help to let them know, hey, we had these losses, but these are the things that we're doing to correct those issues for the future, your underwriter can give you that scheduled credit if they've determined that that's satisfactory for the risks appropriate for your work being done. Okay, so how can you impact pricing? Focus on correcting your loss history and making sure your underwriters are aware of all the safety efforts that your organization is participating in. Okay, so what is the experience modification factor? That was one of those four elements we talked about on the previous slide. It tailors the cost of the insurance to the loss experience of that business. It's promulgated by the National Carrier of Compensation Insurance, something along those lines. It's a big organization, and basically what they do is they compile all this data from losses for specific industries and say, this is the average loss for this industry. And then they look at the specific business loss and say, is that higher than average or below average? And that's why we see 1.0 being the average value. That gets modified on a rolling 3-year period. We're going to see how all these things kind of line out in a minute. Medical only claims are discounted 70%. If you don't listen to anything else I say tonight, listen to that one dot and then listen to the return to work side. Right? As a consultant, I work with a number of organizations around the state, and I've found that once organizations grasp getting folks back to work, the importance of doing that well, and that medical claims are discounted 70%, they start to really understand how they can control their loss moving forward. Okay, so medical only claims are discounted 70%, and indemnity claims have a huge impact on the EMOD. So those claims that have those wage loss, so not medical only claims, but they're indemnity claims, two separate kinds of claims. The indemnity claims have a massive impact on the EMOD, okay? So this is just another visual way of seeing that. You have the experience modification factor of 1 right there in the center of that bar graph. Anything below that, going down to 0.7, decreases your premium. Anything above that, 1.1, 1.2, 1.3, is going to add more to your premium. Basically, that's the penalty for having significant claims moving forward, okay? Now, again, this can fluctuate year to year, but it's based on a rolling 3-year average. So if you have one bad year, you can balance that out in having a number of years, right? Or a number of even years, a number of non-significant loss years. So this is where we start seeing that calculation come in as a receipt for the safety efforts that have been done to this point. So here's an example. We have a class code of 5645. I don't know what the class code for firefighters is, and I know there's a number of different ones, but the class code for 5645 is for residential carpentry, and that class code has a value of $12.04 per $100 in payroll, meaning that when we're calculating how much it's going to cost to insure this group, the residential carpentry has $12.40 per $100 in payroll for what they do. Now, we see on that next line, they have $1 million in payroll. We see the calculation below that. That means that for us to insure this group of residential carpenters, it's going to be a policy amount of $120,400. Okay, so that's just baseline from them doing business and needing to have insurance. This is how much their premium is going to be for doing work in the state of Montana as a baseline, just for doing the work and having that payroll. Now, you can't just have carpenters out there running around. You got to have some clerical staff to balance it all out and make sure they're doing what they're doing, right? Handle the contract side. So that's 8811. Now, the clerical staff are not going to be exposed to as great of hazards as residential carpenters, okay? So office clerical staff, 31 cents per $100 of payroll. That's way less than $12, right? And they have $100,000 in payroll for that specific class code. So you have 100,000 times 31 cents is $310 in class code 8810 for manual premium. You'll notice that in that second line under class code 8810, it says in payroll in 5645. That is a slide error. So not to confuse anyone, what we have for a total premium is $120,000 for our carpenters, the $310 for our administrative staff, which brings our total manual premium just to do business. That organization set up like they are with that payroll in those class codes is $120,000. Well, $120,710 of manual premium. Okay, so that's how the manual premium calculation is made. So just doing business in the state of Montana, just having your firefighting organization as it's set up, this is how the manual premium is getting set, right? Nothing so far has influenced the pricing based off of the loss that has been experienced by the organization, okay? So now we have our manual premium. We have an experience modification factor, an E-mod of a 1.24. Now thinking back to that bar scale that had the red and the green triangles, what do you think this is going to do to that manual premium? Is it going to increase it or is it going to decrease it, right? It's going to increase it. Anything over 1 is going to increase it, right? So now we have the $120,000 times 1.24. Now that went up almost $29,000 to $149,680 for a modified premium. So that's simply because you had more losses for your organization than compared to other similar organizations. You have greater premium value, okay? Now, you have a scheduled credit or debit. Now that's below 1, right? So going back to that bar graph, that's below 1. So now they're taking 5% off of that. And the reason that would happen is because the underwriter who handles the scheduled credit or debit is saying, oh, I've heard either through like someone like myself, a safety consultant who's gone out to your organization and worked with you and said, hey, you know what? These guys participated in this Work Comp 101 training. They were super engaged. They took notes, asked awesome questions, told us how they're going to apply it. And I really think they're going to do it. I let the underwriter know that. The underwriter's like, tell you what, even though their E-mod went up 24%, I'm gonna knock 5% off the top because I want to give them credit for what they're already doing, right? So it's a way that it can balance, okay? So now you have the 149,680 times the 0.95 leaves us with 142,196. So that's the final premium that would be calculated through this process. So really what we've covered so far is just why we have workers' compensation, what workers' compensation actually covers. And now we've talked about some of the financial bits to see how all these different elements factor into one another, right? And of course, the big thing that we can impact is that E-mod, which you can see that E-mod of a 1.24 added so much more to the annual premium, whereas the credit was able to reduce some of that. So it's really important just from looking at this slide and what the total final premium is to see that, wow, what we're doing to, one, prevent claims from happening on the front end. That's where I'm coming in, right? And then two, how we manage the claims and how we get those employees back to work. That's Jodi's side of the conversation. How we do those things can have a dramatic impact on what our departments have to pay in premium year to year. Does that make sense? Okay. And so now we're going to get into the claims reporting side. And Jodi, this is where you wanted to jump in. Is that correct?
Yes. Yep. So should I share my screen
Yep.
now with
So
my
what I'll
slides?
do
Okay.
is I will stop sharing. We'll go
Okay.
into a group, and then Jodi will share.
All right. Okay. Can you guys see my screen okay? Everyone?
We can, just it's not in slideshow mode yet.
Okay. How do I do that, guys?
Just click slideshow at the top there.
Slide. Okay, here we go.
There you go, and just
That
go
good?
from the beginning. Just click from beginning right on the end. Or just do from current slide. Sorry. Whoops, sorry.
It's
That's
okay.
okay. That's okay.
I can
We can
just,
scoot
There you
forward.
go. Sorry,
yeah,
thanks.
I'll just scoot towards, let's see. Okay. All right. So, an injury happens on the job. What you guys are going to want to do, as an employee, if you're injured on the job, as a rule of thumb, we, obviously want you to report that right after the injury occurs. We highly encourage that. But by law, you do have 30 days to report, or to notify your employer of an injury. You have up to 1 year to file a claim. And the employer has 6 days to submit it to the insurer or to Montana State Fund once you are notified of an injury. So that's with a specific injury, you slip and fall, you fall off a ladder. That's a specific injury. An occupational disease or cumulative trauma would be someone like me who's sitting at a desk all day and I'm typing, I'm doing repetitive work, and I'm filing a claim for, say, potential carpal tunnel. So that's what we would identify as an occupational disease versus a specific injury. With that, an employee has 1 year from the date that they knew or should have known of this disease. So typically that it ranges. That can be different. But a lot of times what we do is, or what we see is, it's the first time you go to a doctor and you tell a doctor, hey, these are my symptoms. I attribute them to my work. Okay, that's typically when we're going to go off of that new or should have known. Next slide would be specifically on claim reporting. So as I previously mentioned, an accident should be reported as soon as possible. We would like, no later than the same day or same shift. And then as an employer, we again want you to notify Montana State Fund as soon as possible when you have been given notice or knowledge of that injury or occupational disease. We again would like, you have up to the 6 days to report the claim to us, but we do like that within 24 hours of your notice or knowledge of the injury. Legally, an employer must submit reported claims within 6 days of being notified about an injury or occupational disease. So either the employee that is injured, either their supervisor or designated staff person is going to be the one that has to fill out that first report of injury with the employee. State law does require that. And we do want you to be complete as possible when you're filling out the form, to give us as much information as you can on that form. And then the employer will want to sign that form, and then the injured employee will also sign and date that form and get it back to us. We do recommend reporting an injury online. You can go to our website, and that's very helpful. At the top of our website, at montanastatefund.com, there's a tab right at the top about reporting an injury. And then there's steps on walking you through how to do that, which is great. And it tells you how to securely do that online. If you're unable to do that online, you can obviously call us at the number we have listed here. This is creepy. The lights just went off in the building. I'm sorry, I'm in the dark. But you can call us at the number listed here, and one of our customer service specialists will complete the first report of injury form, which is our initial claim form, with you over the phone. So that's an option. You also have an option of completing the first report of injury form and then just mailing it in to us. You can email it, you can fax it, or mail it to us. And I have our email, fax, and our address listed on this slide. And again, any questions that you have on filing a claim or, any of that process, please always feel free to call, and either customer service specialist can walk you through that process, or a claims examiner. Anyone is more than willing to help you on how to report an injury or the steps following that.
And for those of you, just real quick, for
Yep.
those of you who may be concerned for Jodi's safety in a building where the lights just went off, we're in an extraordinarily fancy building there in Helena. That's one of those special environmental buildings where at a certain time it'll cut the lights off anyway. So I've been in meetings where this exact thing's happened. It's just because we're trying to conserve energy there to state fund.
Yeah, if I get up and move, I'm sure the lights would go on, but
sorry about that. I just wanted
no,
to put everyone's mind at ease.
yeah, I'm just sorry if I look like it's probably creepy seeing me right now on the screen. But so as far as when you're filling out that form as an injured worker or as an employer, well, really here with an employer and filling out the first report of injury, we'll need your policy number. We'll need the injured employee's first name, middle initial, and last name. We would need the social security number, their date of birth, the date and time of the accident or injury, and then a description of that. And then the date of when you were notified as the employer is very important to give us that information as well. And then other steps really is just urging your employees, if they have an injury, to seek proper medical care if necessary. If it's an emergency, we would encourage them to go to the emergency room, or if it really isn't an emergent thing, but they need medical care, we encourage them to seek medical care as soon as possible. We do send out at the onset of a claim, the injured worker gets a lot of paperwork from us, and it can be a lot, but it's very helpful, and it gives a list of providers that they can go see that take work comp insurance with Montana State Fund. So it gives them a provider list of who they can see. As Montana State Fund, we do not direct care. The injured worker is absolutely, they're the ones who are picking who they go to. We don't direct the care. But again, it does have to be with a provider that takes Montana State Fund, our insurance. So after they seek medical care, or, if they decide to go to the doctor, another thing as an employer that we would encourage you to do is send them with a medical status form. Every time an injured worker goes to the doctor, we do require that they take a form and have the doctor fill that out after each evaluation, just so we know, okay, yeah, they're released to modified duty. They can only lift 10 pounds right now. That's very crucial information for us to know, you as the employer to know. Or say they go in and the doctor's like, you're absolutely fine, you're released to full duty. But each time they have a medical appointment, we see people go in, like if they go in and a doctor will say, okay, now you'll do some physical therapy, you'll come back in 4 to 6 weeks. So we can document their progress and get an updated status on what they can do work-wise as well. But we do really encourage people to take that medical status form in there and have their doctors completing that after each evaluation. We then we encourage our injured workers to follow up with their employer with that information to say, hey, my doctor released me to modified duty. Here's what I can do. Do you have this modified work available to me? And then they're also, we encourage them or want them to contact Montana State Fund with that information as well. hey, I just saw my doctor, I can work, or I got released to light duty, my employer can accommodate me. Perfect. That's great. There's no wage loss involvement there. You're gonna, accommodate the modified duty. So that's great. And then we just really encourage you to talk with your employee when an injury occurs, discuss the how, when, and where of the accident, and just be as complete as possible, and sign the form with your employee. We do encourage you to report even minor injuries, whether or not medical treatment is sought. And just, assist your employee with the process of coming back to work as soon as it's medically appropriate. Any questions from anyone so far? Um, and then, so really, our process here, or really like my involvement is as a claims examiner, is once we receive that first report of injury. So once an injury occurred, the employer has and the injured worker have submitted their signed first reports of injury. If you've provided all that information to us, then there's no follow-up necessary. But our customer service specialist will enter in that claim, and it generates what we call a claim number. And that is what the injured worker is going to use when they go to a provider and seek medical treatment. They're going to say, this is my claim number. Here's my date of injury. Montana State Fund is my work comp. This is a work comp claim. They're my insurance company. So after we enter it in, it generates that claim number. Our customer service specialist will call the employer and the injured worker with that information, which is really nice, just so everybody has that right at the get-go. And then after it's entered into our system, the claim will either assign to a claims examiner to handle the claim, or it's placed in what we call auto adjudication status. Our auto adjudication status is really for those very minor claims that are identified. It's somebody scraped their hand, or maybe they bumped their knee on something, and we're looking at it and there's no work restrictions. They've been released to full duty. They just went and saw the doctor that one time. So that's going to default to that auto adjudicated system. If a claim is wage loss or it's complex medical, obviously we're going to want our claims examiners to be handling those claims. And then the system generates a letter to the injured worker that explains coverage available. The employer also gets a copy of that. And then the next steps is the examiner is going to make contact with the injured worker and the employer within 24 hours of that claim assignment. And that's really crucial. And just, the examiner is really here to help the injured worker and the employer. Like, we all want to be working together in this process. I think when that happens, there's a lot better outcomes on claims, when we're all, working together, just as a team on that. So I really like to keep in pretty close communication. I mean, if it's a medical only claim, you're not as in communication as much with an employer or an injured worker on those claims. But when it's wage loss, I mean, we're really touching base with the employer and the injured worker pretty frequently. I mean, after every office visit, we're touching base, or just with the employer, we're saying, hey, heads up, the injured worker has an appointment coming up in a week. What are your thoughts? I mean, I know they're not released to work now, or maybe you don't have light duty available now, but what can we do to help this person get back to work? Is there anything we can identify for them to do so that I can then, get that sent to the doctor before that next appointment, and have the doctor take a look at that and say, hey, yeah, actually now they can do that light duty work, and that's great, and they'll sign off on it. So it's just important, I think, to be, communicating with one another on a frequent basis, especially with, like I said, the wage loss claims. And then compensability of a claim is determined within 30 days of a receipt of a claim. Obviously, we want to make those decisions as soon as possible, especially if it's a wage loss claim. And so when we're determining compensability or the liability decision of a claim, The components there are going to be, we need that signed first report of injury. We need that initial contact with the injured worker and the employer, especially if it's wage loss. Medical only claims, that's not really as big of a deal, but still we want to have that initial communication and documentation of, okay, yep, we've got this consistent mechanism of injury that's noted with the injured worker, the employer. If the employer is questioning it, we're obviously following up on that because we really want to know the reason for questioning. Do we have potential surveillance that says, hey, this injury did not really happen the way they said it did? So yeah, we're following up on things, especially if an employer is questioning it. And then another component is we're requesting medical records. If the person has indicated they're seeking treatment, we're going to be requesting those medical records. And then once we have all that information, we've got our signed FROI, we've got our contacts with our injured worker and employer, and we've got our medical records, then we can make a liability decision on the claim. In the medical records, we're looking for the same, we're making sure that mechanism of injury is consistent with what is reported. And there needs to be what we call objective medical findings to support that an injury was sustained in course and scope of employment. So objective medical findings are going to be bruising, contusion, limited range of motion, things like that. We can't just go off of subjective complaints or subjective pain. There does have to be those objective findings on an exam. So that's what we need to make a decision on a claim. And like I said, we've got the 30 days, but typically if we have all that stuff, I mean, a lot of times we can get that information within 1 to 2 weeks, depends on, I guess, the provider or where they've sought treatment. But again, if I have all that information in a week or 2 weeks, we're making those decisions as we have all that information. We don't want to delay decisions on claims, especially if someone is going to be on wage loss and entitled to benefits. We really want to get them the benefits out that they're entitled to. And then really there's 5 major components of claim management on an examiner's behalf. Again, it's that initial investigation that I just kind of went over with you, and compensability of claims. And then if we have accepted a claim, we're focusing on medical management of a claim. We want to ensure that the medical treatment is necessary and related to the work injury. We only have liability to pay for medical treatment that specifically relates to the injury. We don't want to get into situations where it starts to turn into something where it maybe appears to be related to their pre-existing condition. Say they have had an injury to that same part of body prior to our injury. We really want to make sure that we are paying for medical treatment that's related to our specific injury. So that's a big component of claim management. And then really we want to pay for medical treatment, or we pay for medical treatment until they're at what we call maximum medical improvement. So meaning they've achieved maximum healing from this injury. Injured workers do have up to 5 years to seek medical treatment on a claim. So even if we get them to maximum healing, that doesn't mean that they're done and they can never seek medical treatment again. But if they do reach maximum medical improvement and need ongoing treatment, again, that treatment does have to continue to be related to that original injury in order for Montana State Fund to keep paying for that. We just want to ensure that, again, we are paying for treatment that relates to the injury. And then indemnity management is going to be those claims that turn wage loss when someone misses more than 4 days of work, and we're paying what we call temporary total disability benefits. If they are completely and temporarily removed from work, we're going to pay them what we call the temporary total disability benefits. And then really just with indemnity management, again, like I previously stated, we really want to work with the employer on staying in communication as far as, hey, he's off work. We think he's going to be off work for 4 to 6 weeks, but, at that next appointment, what are we thinking as far as any light duty available? Um, and Stormy will obviously touch on return to work and how that's so important, but really, the indemnity claims are going to have a much larger impact on your policy. So light duty is very important if you can offer it. And it's also important for the injured worker. We see the longer someone remains off of work, their chances of getting back to work, I want to say after, I don't know, 6 to 8 weeks, at least from my experience at a desk, it gets very challenging to get someone to get motivated to want to go back to work. Um, so as far as indemnity management, we're working with the employer on, return to work. We're working with our providers, our doctors, and saying, fill out this medical status form. We can also get what we call job analysis completed, and that's with a vocational rehab specialist. They will contact the injured worker and the employer and work with you guys on what we call time of injury job analysis. That's going to be just much more specific than just a job description. It's going to be more specific measurements and timeframes of or specifics on what they're lifting, how much they're lifting, how often, things like that. And then that gives the doctor a much clearer idea of what someone is doing. A lot of times an injured worker can just go into a doctor and say, oh, I can't go back to work. I just can't. My job's really heavy, without the doctor really knowing what that job entails. So those job analysis can be really, they can be very helpful for the doctor to see, for the injured worker, for all of us to have that. So, and then really with indemnity management, we are paying wage loss benefits to an injured worker up until they are released to go back to work in a capacity that an employer can accommodate, or until they're released to full duty. We also do, along with temporary total disability benefits, we do pay partial benefits. So say someone is released to only 4 hours a day, 5 days a week, we can step in, and so the employer would pay the 4 hours that they work, and then Montana State Fund would offset that and pay the hours and wages that they're not working. And then say, I don't want to get too far into this, but if they're not released to come back to their time of injury employment, at the end of a claim, we do have options of having our vocational rehab specialists identify alternative work that they might qualify for, because the goal is just that we want to get people back to work. And if it can't be with their time of injury employer, we want to help them, we want to identify and help them find other work. So and then at the end of a claim, when we get someone to maximum healing and we've got their employability established, we can look to settle claims. It doesn't have to be, it's not like we settle every claim. It has to be in everyone's best interest, but settlement is an option. And that sometimes is just a positive thing for everyone. It can help the injured worker kind of cut ties with the whole claim process, and it gives them the chance to seek treatment kind of just on their own without having to get approval from state fund for everything. It allows them to just freely treat with any doctor that they want to, and then it closes out that claim, really. So and then just if we don't settle a claim and it's not in everybody's best interest, we do look to close a claim, and that's truly when a provider says, they're at maximum healing, there is no further treatment that relates anymore to this injury, and so those are claims we're identifying to close those out. So and then there's a variety of tools that we have as claims examiners, because we're not medical professionals. So we have obviously our designated treating physicians that are injured workers, that when they go see, they have a designated treating physician. We can also get independent medical examinations. We do have internal medical doctors here at Montana State Fund that assist with us and with treatment and what's appropriate and within our utilization and treatment guidelines. We have vocational rehab specialist, we have a fraud unit, we've got legal counsel, we've got Stormy safety management consultants, and we've got medical case managers. So yeah, and I kind of already went over this, but if you guys would like to kind of chime in on how you think or how should the employer interact with claims examiners that that you would find helpful, if anybody wants to chime in on that.
Excellent. Thank you, Jodi.
Yeah. Yeah, and then so yeah, Stormy can go into the return to work aspect here.
Excellent. Thank you. So we'll go ahead and switch screens here so I can drive again and wrap up our last few minutes. All right. So we went through this claims reporting process. So just as we get into this, guys, we've covered a ton of information. We're almost at the end of our time, but I really just wanted to kind of tie all this back, right? I went through all the jargon with how the policy is and everything else, and then I went through the really riveting, and I'm sure you all were super fascinated by how the premiums are calculated, right? Some of you are, right? Alicia might be. She's dealing with some of that stuff. But really the big point of why we're doing all this, as I was just listening to Jodi and she's talking about all the things that they would do to all the claims examiner staff do to care for our employees, it's really important that we understand that the reason that we're doing all of those things, we're providing the best things that we can for our injured employees, right, is the same reason why you guys are doing what you're doing. Right, you guys volunteer and do or have signed up to provide a service that is a dangerous service for the community that you're in, and you want to do the best for that community as possible, right? The best that you can do. Same thing with State Fund. We want to provide the best service to our injured employees as we possibly can, and at the same time help partner with those policyholders that have their work comp with us, to have the best means to respond to an employee injury and get them back to work. And so just in the last few minutes, I just want to take a moment, touch on this, and then open the floor for any questions that you guys may have. What is return to work or stay at work? So basically, like Jodi was saying, when an employee experiences an injury that impacts their ability to do their job, we're going to have to find a way to modify the job they're doing to help them stay at work, or if they've been off work because of the injury, help them return to work based off of what the doctor is saying they can do, they being the injured employee. So again, return to work is getting injured employees back to work as quickly as possible to help them, which is helpful in not only their healing, but also keeping that institutional knowledge there at work. Because I don't know about the fire industry, but all the other industries I interact with are dealing with, man, it's really hard time to find people to do the job, right? So when they get there and you guys put them through all the training, you guys want to keep them there. You guys want to keep them around. And just the communication process of return to work can help that retention value. So it benefits employees, and it also benefits the employer. So this isn't just, well, now we have to get this employee back to work so that they're getting their full paycheck instead of the 2/3. This is for both sides, right? It retains good employees is the big one, and it also manages claims and premiums, right? Which is a secondary factor, but you're retaining your employees. And science has shown that it helps your employees recover, especially in a culture like a fire department, when those folks can stay engaged with the folks that they're serving the communities alongside with, right? So just some questions to consider. How are you currently managing your claims, and how are you currently managing return to work? Do you stay in contact with your injured employees? And I think that just the culture that I've interacted with when it comes to the firefighting groups, you guys do a good job of it. It's almost like a family. It's a lot more family oriented than a lot of the other organizations that I work with. So what are some things to do to help this process? Confirm management commitment. Let them see why it matters to bring your folks back to work and not leave them off if they're taken off work for an injury, right? Who will manage the program? Having all those items lined out at the beginning is super important. Step two, develop some job descriptions. What that means is, what are some jobs where if I have a firefighter that can't perform this task, what can they do? Can they run the radio? Can they run comms? Can they handle certain, other things? Can they help with the medical side of stuff? Those are the kinds of things we can think about to say these are light duty tasks with whatever that looks like for your group. And identify transitional jobs, right? Those would be like, hey, if you're going to be off for some time, we have a job that you can perform while you are off recovering. And be creative, right? Be creative to find something valuable, right? Not something like, we're going to have you paint fire hydrants. Maybe that is valuable, right? Maybe you got that one, right? That's in rough shape. But be creative with how those things are and that they're actually of value to you and the community that you're serving. And then communicate the program. Make sure that all the firefighters, all the folks at that organization know what it is you're doing. You want to get folks back to work. Involve employees in the planning process for how this is going to look. Hey, if you get injured, what do you need from us? What can we provide for you? What are we going to need for you to help get this claim closed as quick as possible so that you can come back full time, right? And make sure that employees have access to all this equipment that you guys would have to bring them back to work. At State Fund website, safemt.com, which is our safety side of the website, we have a ton of information for your own grab and go kits. All that is all the medical stuff, all the medical paperwork that Jodi was just talking about, how you would report a claim to State Fund or your insurer. All those elements are there at that link there. So safemt.com/return to work. That is going to have all of those elements there for you to take them and retain for your own return to work program. Letters to the medical provider, letting the medical provider know you guys are there to get them back to work and that you value your firefighters. Medical status forms, job descriptions, which would be those ones that you came up with, right? First reports of injury and incident investigation reports. Those are just reports for yourself if you do have that injured employee. I know that you guys are really focused on all the work you do and calculating all the work that's being done by your firefighters and by your team when you're on the site. This would be for that specific injury. How did this individual get injured? Okay. So with that being said, I want to give us the last few minutes just to ask some questions that you guys may have. I know I got questions for you guys, but if you guys have any questions, now would be the time to ask with regard to anything that we covered about this evening. And I'm monitoring the chat too, so if someone needs to be in there, that's fine.
Hi, Stormy. This is Alicia from Big Sky Fire Department. Can you hear me okay?
I can hear you great.
I was wondering if Montana State Fund offers a service to actually visit our stations to go through a safety assessment. We have a health, safety, and wellness committee where we address different facets from NFPA requirements to mental health, our firefighter physicals, or all sorts of things. But one of the things we've talked about is bringing in, if it's available, Montana State Fund to do kind of a safety program assessment and just safety in our stations.
Yeah, that's a great question. And so Alicia, do you have your work comp with State Fund? This is a part of it that I just didn't quite understand. Okay, perfect. Yep. So if you do, then yes, that would absolutely be something that we can perform. In fact, I think my counterpart, so myself and Dan Johnson is another one of our SMCs. Both of us actually work in that Bozeman Big Sky area. So okay. I think he might actually have Big Sky because you guys work for the city, yeah?
We actually are a special district of the county, so we're not a municipality, and we cover a portion of Gallatin and Madison County. Okay. Our district does. Yeah, so we're a fire district.
Okay, got it. So then what I'll do, Alicia, do you is there
I can put in the chat my email. I mean, I don't mind.
Perfect. Yeah, that'd be great. So what I'll do is I'll get your email from the chat, and then once I get that, once we're done with the training, I'll look for your policy, see who's associated. I got that. Thank you. Okay. See who's associated with your policy as far as an SMC, and then we'll be in touch. Either it's myself or Dan or Mark Rosenleaf or Tanya, I guess is the other one that was added to that same area.
Okay, that'd be great. Thank you so much.
We'll be in touch. And okay. Yeah, that's absolutely something that not only we do as consultants at State Fund, but I think it's also just a good idea for anyone who would be looking at that from that perspective, right? Well, hey, we're really good at knowing how to do this thing, but what about safety for our folks? What about safety here in the shop? What about the safety programs we should have?
Exactly.
Inviting in someone from the outside is an excellent way just to get another point of view of that specific hazard, or to see, hey, are we missing it anywhere? Could we enhance our safety program anywhere? So yeah, that'd be great. So I got your email,
Okay.
and so you and I'll be in touch.
Yeah, that's great. Thank you so much. And thank you both for your time tonight.
Of course, thank you.
That's great. Does anyone else have questions for Stormy or Jodi?
If not, I have one more thing to add, and then
Okay,
I'll
yeah,
stop
go
talking.
ahead.
So anytime I get a chance to talk with groups, it's always, I'm a safety guy, right? So a lot of times people will talk about safety and it's some big production. It's got to be some big difficult thing. Man, the most effective question we can ask each other to help look out for one another when we're on the job, whatever the job is just asking, hey, what are you doing today that could get you hurt? That simple question, open-ended. And what it does is it lets you start thinking, hey, what am I doing that could get me hurt? And it helps all of your people that you're working with start asking that question. And you might never see it, but if someone says, you know what, this might get me hurt if I do this, and they pause for a second to think about a safer way to do that, and that pause prevents a significant injury, friends, that's what we're here to do, is to prevent injury, right? So anyways, just as you guys are leaving, I leave you with that parting thought. Just ask yourself and be willing to ask those around you, hey, what are we about to do that could get us injured? How can we prevent that?
That's great. That is some really great advice. I appreciate that. As I was thinking about Kim going down the stairs today carrying big boxes, I'm like, Yes. Good. Well, thank you both so much. And thank you to everyone who joined. This is going to be a really valuable recording for a lot of people who didn't make it tonight. There was a lot of really valuable information. So we thank you both so much. And thank you to everyone who attended this evening.
Thank you.
All right. Good night.
Thank you.
All right. Take care. Bye-bye.
Bye.